The debate has been raging as to whether or not public hospitals, including private practitioners, should be entertaining the patronage of suspected cases of COVID-19. Is the risk to the general public of exposure to coronavirus not too clear for everyone to see? Shouldn't everyone just do the right thing and begin to abide by the stipulated guidelines of reporting all suspected cases to special centers created for this purpose? Well, on this program, we have hosted a private hospital owner who made a bold claim that without public and private hospitals, it will be difficult to win the war against COVID-19. The health needs of majority of Nigerians is already being catered to by these hospitals. And on that score, wouldn't it make sense to incorporate them into the template for fighting COVID-19? A lot of questions, but to get a better understanding of all of these issues, we're now being joined by Dr. Chris Bode, Chief Medical Director, Lagos University Teaching Hospital, Professor of Surgery, and Consultant Pediatric Surgeon. Professor Bode, good morning. Welcome to the morning show.
Good morning, Doctor. Welcome to the program.
Good morning. Good morning, Dr. Bati. Good morning, Leila. Thanks for having me.
Yes, thank you very much for joining us. Well, you must have had the introduction.
That's
what
right.
level of synergy should we be seeing between private hospitals and public hospitals and the designated centers? Or is the treatment of COVID-19 something that should just be restricted to designated centers? And how do we manage the fact that many patients, their first port of call will probably be the general hospitals or a private hospital? Recently, this was a subject of controversy when the Ministry of Health and the Center for Disease Control said private hospitals that do not have the necessary approvals should not attend to COVID-19 patients. What's your take, Professor Bode?
Thank you very much. Thank you very much. We need to see how we can synergize the services between the primary, secondary, and tertiary levels of healthcare in Nigeria, especially under this siege that we are having to battle the ravage of COVID-19. There are designated institutions which we call isolation centers, where patients with COVID-19 are isolated so they won't continue to be a threat, a source of continued dissemination of disease within the community. That is why the word isolation is used. It also takes a specially trained team of healthcare workers, a whole team, to adequately take care of such patients without them spreading the disease further, without the team getting infected and taking that infection back to their homes, to their communities, and all that. So as far as many hospitals are concerned, less hospitals where training has not been done, all they should do is try and identify the number of patients, whoever has COVID-19, through simple questioning, even while maintaining a distance with the patient. And once it's likely to be, referred to a place that can handle it. Otherwise, as we are already witnessing, healthcare workers can unwittingly catch this disease without knowing and spread it within their own communities to their families without knowing. Back to what hospitals with training should do. They should, and that's what happened in Luth. As far back as January, we knew we will be part of the treatment plan for Lagos. With over 20 million persons in Lagos, we knew we had to be ready. We started training, even while people had doubts and they had real fears. We had to start training, and initially through an all-volunteer team of about 120 persons, we were training and training. I can tell you that in the last 3 weeks, we have tested over 200 patients. We have admitted 85 patients, and presently as I speak, we have 58 COVID-19 patients on our ward. Because of the training and the safe way in which we've handled these cases, not a single member of staff, touch wood, has caught COVID-19 from the patients that come in. Whereas we have patients who are catching it right, left, and center in other hospitals where such training has not happened. So to summarize my answer, it will be that as many centers that could be trained should handle COVID-19 patients. But without training, it is dangerous to the larger community. Thank you.
Thank you, Professor Bode, for the clarifications that you have given us. Now, you stated that, and that's great news to hear, that no health worker at Luth has actually tested positive for COVID-19, and you have 58 COVID-19 patients at Luth as it stands. Now, I also believe that you have a 60-bed isolation center at Luth. So do you see yourself getting overwhelmed sometimes? Oh, sorry, it's a 120-bed isolation center that you have at Luth. In that case, then, what challenges do you see yourself facing at Luth, given the increase in cases that we're seeing across Lagos as the epicenter?
I will tell you, it takes a whole bunch of people who are inspired, who are dedicated, and who are determined to battle this to make it work. I'll tell you what happened in Luth. I had to personally appeal to my colleagues, all staff in Luth, that if we didn't rise up to this condition, COVID-19 will possibly start looking for us in our homes. That got the attention of everybody. And then through training, the fear abated. And with that, we were able to see volunteers who came forward and said, look, I want to be part of this. Why do people do volunteer in such a time of war like this? For altruistic reasons. Some for the monetary reward, many for fame, and some for self-preservation. All these factors came together, but we are happy, delighted at the way we have been collaborating with the Lagos State government. We have almost 50 members of our Luth team working with the Lagos State government hand in hand closely in contact tracing. You remember that our laboratory in Luth and College of Medicine was the first to test and confirm the first cases of COVID-19 in Nigeria. And not only that, we are part of the EOC in Yaba, now with our own isolation center in Luth. And we have had a rapid turnover of patients, and we are doing quite well. What are the challenges? Let me also thank the community at large. Many people will bring things, water, milk, sugar, beverages, all sorts of things, PPEs, for these gallant workers who are covering the occasion, the situation. What we need mostly will be a continuity of supplies. We would need to, you cannot go to war and then your bullets finish. So we need a continuity of supplies, personal protective equipment. My staff who are working have to stay in hotels. Even when they finish, they cannot go home, so they don't possibly transmit the disease to their relations and family. So they stay in a hotel for 2 weeks if they have finished work before they come back again. Hotel services, we have to get hotels for them to stay. Continue feeding patients and staff. As of today, we're spending over 1.6 million naira a week to feed both staff and patients who are on the ward. Not only that, and I must, in this regard, thank the Lagos State government for their contribution towards the feeding of patients. We don't want that to stop because Luth will not have the financial backup to be able to continue this effort. So everybody needs to pitch in. The federal government, the Federal Ministry of Health, NCDC have done wonderfully in making sure that we are fully backed, and I must thank them. They stood up to the occasion, and that's very good. Your question about what next, what are my fears? What do we do when 120 beds are filled? I don't readily have an answer, but that will also be part of what, in talking with the Lagos State government, what other areas can we open up, rapidly train people to also jump into the fray so we can contain this disease before it spreads. Thank you.
Well, Prof, I like the fact that you talked about what challenges you face and the need to sustain supplies. But are there other challenges you face in terms of the process of attending to patients who present with symptoms of COVID-19, either in terms of protective equipment or testing kits or some other things that you may need? And in that regard, apart from your experience at Luth, what's your assessment of the national response so far? And do you think that it's a good idea to relax the lockdown so that businesses can reopen at this point?
Thank you. Those are three questions. Let me take them one by one. To be honest, we are being fully backed by NCDC, Federal Ministry of Health, and Lagos State. We will want more, but they also will have to work within the limits of what they can do. What they cannot reduce in terms of supply will be how to take care of patients, how to take care of our workers, and how to supply things to the hospital. Now, let me mention a problem we also have. Apart from COVID-19 patients, the 58 we have as of this morning, there are other patients who are non-COVID patients. They also need care. They may, among those patients, may be COVID-19 patients that we don't know, that are asymptomatic, that can bring that disease to our hospital. How do I protect my staff? Who pays for that? A packet of 50 face masks that we used to buy for 800 naira now costs 13,000 naira. How many of that can I afford? The millions of naira I have to spend buying masks, buying gowns, buying gloves and all that. Who pays for that in the face of dwindled and dwindling resources for the hospital? That is part of it. How do we transport other workers to the hospital in the face of this lockdown? People that come all the way from Songwater, that come from Ikorodu, that come from Ikotu, and we need the support of the state government to put.
Prof, sorry to interrupt you. I heard you said we need the support of the state government. But we need to take a short break. Then when we return, we'll continue with the conversation. Please stay with us. Welcome back to the morning show here on Arise News. Still with us is Professor Chris Bode, Chief Medical Director of the Lagos University Teaching Hospital, Professor of Surgery and Consultant Pediatric Surgeon. Professor Bode, thank you for staying with us. We just had to take that commercial break. And you were making the point about support from NCDC and support from the state government. If you may just continue from where you start.
Like I said, before I ask for more, I must thank those two bodies and the federal government too. They've solidly stood behind us. Our staff at the Lagos University Teaching Hospital find it difficult getting to work. Even if we get some dedicated buses that can fly certain routes, services will be improved. We appeal to the police to please be lenient with our staff and their spouses when those are going and coming back from work, so that we don't get an industrial unrest on our hands. Sometimes our staff get harassed. My own personal driver was detained till the following day without anybody wanting to see his ID card. All these kind of things should not happen. Challenges include the fact that you also use this medium to let my colleagues know that it has gone now beyond just treating COVID-19 patients. We must also treat so we can minimize collaterals. Non-COVID-19 patients should not be allowed to suffer unduly. And while we are protecting ourselves, we must also be on the forefront of ensuring that no life is lost unnecessarily. 2 days ago, we had the first cesarean section on a COVID-19 patient at the Lagos University Teaching Hospital. And as far as I know, this is the first to be reported in the whole of Africa. This is cheering news. And it's due to the gallantry of those heroes, people I admire so much, the nurse, the cleaner, the doctor, the surgeon, the anesthetist, everybody that came together to make sure the mother and the baby came out of the operation successfully. So as we are doing this and carrying out these acts of heroism, we need the effort of all partners, not to relent and not to back away from us. That's what I would say. Thank you.
the team at the Lagos University Teaching Hospital for successfully delivering the baby that was born the other day. Now, I wanted to bring you up on something, a news report that came out 2 days ago with regards to a 65-year-old woman that was admitted into Randall General Hospital in Surulere. This woman was diabetic, apparently. She also presented symptoms of hypertension. She was later apparently directed to Luth, or referred to Luth, where she was apparently rejected by medical personnel because she did not fit the COVID-19 criteria. She was then returned to Randall, where she later died. Can you give us more information on this story, Doctor?
Lena, I am not aware of that situation, but I will find out. Luth does not reject any patient. And if we ask any COVID-19 patient to go away, we're asking them to go and die, because our process is even faster than it could have been in other places. Let me mention to you that that is a very unfortunate situation. We will find out whatever happened to that lady. Even in advanced countries, patients find it difficult getting access to medical facilities. That has led to patients who would phone the NHS in the UK for 6 hours and then be told to await a call from their general practitioner. That is no reason why any Nigerian should die. I'm sorry about that loss. I will find out. I do not have a report on that on my desk. I will be able to talk about it. Yes.
Well, Prof,
but
what in your opinion?
Let you know, we do not reject any patients.
Well, Prof, what in your opinion are the key omissions within the Nigerian healthcare system that the challenge of COVID-19 has more or less thrown up? One, before now, one minister was telling Nigerians that, well, any doctor that wants to travel abroad and seek greener pastures was free to go. That, after all, we have more than enough doctors in Nigeria. But some other people tell us that we do not have enough doctors. So I ask you, as somebody who is in the front line, do we have enough doctors? Is the doctor-to-patient ratio okay? Do we even have enough critical care providers in Nigeria in the face of COVID-19? And is there any kind of special training going on to address COVID-19?
No, we don't have enough critical care facilities to address COVID-19. No, we do not have enough doctors in Nigeria, and the doctor-patient ratio is still quite wide. But what we have in Nigeria is a situation which has accrued to us because of decades of insufficient investment in the healthcare sector. These are my personal opinions. The healthcare sector is a humongous sector as an investment destination if well packaged and if well regulated policy-wise. The federal government and state government and local governments had invested a lot in infrastructure, in buildings and stuff like that. But the cost of running one became so big that it became unsustainable. And the allocations to health over the decades, I'm not saying of this government which is trying its best, over the several decades had been abysmal. So that accumulating effect could not but tell. Take Luth, for example, established 58 years ago. We should have gutted out the infrastructure, the buildings, and refitted the pipes, replaced the roof and all that. It don't cost much when compared to what we'll gain from it. I can tell you that the ward, that 120-bed ward facility we're using, was the first ward to be wholly rehabilitated in Luth in almost 60 years. And that came in timely, so we could use it for this event. Imagine if we didn't have that. So I see no reason why deeper investment should not be made in hospitals like this. Large hospital specialists will make a lot of money for whoever. Those who invested in our cancer center last year are doing well, commendably well. They're asking us, what else can we do for you? So if investors are bold enough to venture into the healthcare sector, they will make good money. That's one thing. The government alone cannot do it. I can tell you that. We need private sector, deep private sector investment. We need deep private sector commitment as corporate social responsibility in these hospitals so that they can serve the community. What has been thrown up this time around is the fact that our people cannot easily travel out of the country. The lady, as I mentioned, would have been flown out if nothing could be done. But now we have to see and ask what can we do within our own capabilities. As regards the issue of the lockdown or what to do, the government has thought it out very well before taking the appropriate decisions President Muhammadu Buhari took and announced a few days ago. I'm sure, I believe that even the watchdogs of government will be on the lookout for what will be the effect of those decisions on whether the disease is plateauing and going down, or if there should be a rise. I'm sure government will very swiftly go ahead to review as necessary. So I fully ask, therefore I'm in consonance with that. We will all, as a community, as a country, have to take care of our brothers and sisters, the less privileged, who will complain and who are complaining of hunger and lack of the wherewithal to survive. But it's better to survive first than and then later complain of lack of this and that than to die from a disease unmitigated. These are my views on that.
Certainly, Professor, I'm sure a lot of people could not agree with you more. We do need to see a lot more of the private sector coming in and collaborating in that regard. Now, let's move on and discuss vaccines. Let's discuss immunization towards COVID-19, etc. I'll bring up a case study. On April 12th, South Korea told us that 111 people who had seemingly recovered from COVID-19 tested positive again. Now, previous coronavirus strains showed that people were able to have immunity for months to years. Of course, there's not enough research yet for us to know with COVID-19, but can a successful vaccine ensure total immunity against the virus? I'm asking this because some governments are already speaking about immunity passports.
Thank you. Let me quickly say that I'm a poor surgeon of babies. I am not an expert in that area. But the much I can tell you as a doctor of 40 years is that it would be good, it would be marvelous to have a vaccine for this condition. It would take, from what we're hearing, at least a year to come up with a vaccine that is worth its salt, that could be administered. And even if it takes a year, we're very lucky. Imagine HIV came in 1980, 81. That was almost 40 years ago. We're still looking for a vaccine for it. So different viruses behave differently. So the search for a vaccine is rapidly on the rise. Everybody's trying to look for one. We do not yet have the answer. Don't forget that this disease has taken the world by storm. Nobody has ever seen it before. And now that we have it, it's been around us for maybe about 4 or 5 months or so. So there is a lot we do not know about it, but our scientists are on the lookout for a good vaccine that will save the world. The disease is not going to leave us next week or next month. It's going to be around for a while. While it is, we must all continue to take all the safety precautions that we've been told, while scientists are desperately searching for something to prevent it permanently. That's the way. Thank you.
Well, Prof, let's talk a bit about research and what Nigerian researchers are doing. A few weeks ago, we were told that DICON, that's the Defense Industries Corporation of Nigeria, had come up with a ventilator that will help. And then also, only today in the papers, we were told of an effort by a group of researchers at the University of Benin who have also come up with, a specially adapted ventilator. Do we really have the capacity to produce these ventilators on a mass scale? And if so, of what value would that really be in this race against COVID-19? But Prof, let's take another quick break. When we return, then we can discuss research and ventilators and testing kits further. We'll be right back. Please stay with us. Welcome back to the morning show here on Arise News. Still with us, we have Professor Chris Bode, Chief Medical Director, Lagos University Teaching Hospital, Professor of Surgery, and Consultant Pediatric Surgeon. Yes, Prof, I'd asked a question before we went on break about research efforts to develop certain clinical care facilities like ventilators. In Jos, we were told some people have been helping to fix ventilators. DICOM says they've come up with a ventilator that they designed. At the University of Benin, we were told that researchers in the Faculty of Engineering and Faculty of Medical Sciences have also done something. Well, all of these efforts, are they of any great value at this moment? And, you know, are you aware of any effort by government to support research and assist these persons who are making some effort?
Thank you, sir. Every effort helps. Every effort made in the search for knowledge helps. And that's what research is all about. There are many questions that have not been answered. And definitely in this part of the world too, we need to address some questions and answer them through research. Any group that can do anything like manufacture, invent, reinvent, adapt, service ventilators will definitely help, because we have poor resources in that capacity. We also need to research drugs, treatment protocols, and all whatnot, approaches to the care of patients with COVID-19. Because what helps in certain climes may not necessarily apply to us. There are some drugs that have been used for years, which are being touted as helpful in COVID-19. We need to validate that. And the best places to do that will be in our tertiary institutions, universities and teaching hospitals and tertiary healthcare centers. And I know a number of them, such efforts are already about to take off in quite a number of hospitals. I will, however, want to mention something, which is my personal observation, that is, we do not have the capacity to match what obtains in the advanced world, and we do not have the ability to quickly ramp that up to meet this ongoing exigency. Therefore, it behooves us to take extraordinary preventive measures, observe all those social distancing, hand washing, not touching our eyes, nose, and mouth, and all those, and social isolation and all those things, so that we do not have a deluge of patients we cannot cope with. If countries like France, like UK, like America, if in those countries people are dying in thousands, we will not be able to cope if we allow that to happen here. So it's very important, therefore, to say it in every Nigerian language, to say it in every mosque, in every church, and everywhere people will listen on radios, TV. Let's say ceaselessly that Nigerians should please observe all those things we are told. We cannot afford to allow that disease to permeate our society because we are in denial. That is what I would say. Thank you.
Certainly, Professor. Once again, I'm sure a lot of us could not agree with you more. We cannot be in denial with regards to the realities of this disease. And on that note, I'd like to get your opinion then on a recent statement that Melinda Gates, the co-chair of the Gates Foundation, came under fire for, whereby she suggested that if Africa is not careful, we may end up seeing dead bodies on the streets, which is the situation that is currently in Ecuador. And she emphasized the fact that Africa does not currently have the testing capacity, is not testing enough, and needs to ramp up testing in order to know what we're really dealing with here. Now, we have been told, firstly, by the Presidential Task Force that we are smart testing rather than blanket testing across the country. And this is an approach that we have decided to take. What is your opinion on that, seeing as the World Health Organization have told us that the way out of this for the globe is to test, test, and test?
Thank you. I will want to say that there is a word of caution in what Melinda Gates said. She wasn't talking down at us because she's a genuine lover of Africa. I can say that about her. However, I've not seen that statement, so I can't say whether she was taken out of context or not. What I would say is that smart testing entails us listening to A, B, do you have this? Do you have that? Do you have that? Does it look like a duck? Does it waddle like a duck? Does it swim like a duck? Is it followed by a brood of ducklings? Then it's a duck. Then we say, let's go and test. That is a smarter way to do it because we do not have enough testing kits. Nobody in the world has enough testing kits. Even as of today, America does not have. The little we have to use smartly, not because people want tests, but because those tests are needed. That we should test those who need it, not everybody that wants it. And don't forget that there's only very few number of places where those testing kits that are most reliable are produced. I don't know whether it's just one or a group of factories that just manufacture. So there's not enough. If we use it just because somebody wants to feel good, we will not be testing realistically. We need to use it for those who qualify for it. That is the issue of smart testing. So it's a good approach, combining. As soon as more testing kits are made, then it will be ready for whoever wants it. Don't forget that Nigeria tests freely. Nigeria does not charge anybody for testing. In Luke, we do not charge for testing. And that is the way, the most commonsensical approach. If we don't differentiate between what we want and what we need, we will soon run into a situation where we won't be able to test at all. And that would not be good.
Well, Prof, Leila asked a question earlier on about the vaccine, and we are aware that there is almost a competitive race among scientists all over the world trying to find a solution, a vaccine to COVID-19. Now, do you think that there is hope in that direction? Because there are some pathogens, they just go on and on and on, and at the end of the day, scientists may not be able immediately to solve the problem. But if that is
HIV has been with us for 40 years now.
Yeah. So if that is the
for it. Yeah. I will therefore say that we must keep up the hope and let scientists do what they do best. That relentless search for a COVID-19 vaccine. We must get it. There are flashes of hope. Some people are testing it on monkeys already. There are some other trials will soon, very shortly, start off. We are hoping that one of these will hit it and we get it for humanity. Otherwise, we cannot afford what happened in 1918, 102 years ago, to happen again, where millions of people died because of the Spanish flu that time. We cannot, I'm sure with the advancements that the world has made in research along this line, hopefully we should get a vaccine. Some scientists are saying within the next 1 year, thereabout.
Well, I was also going to ask you about how the immunity to COVID-19, how it works. Is it possible that there will be certain persons, well, I guess so, who will never come down with COVID-19 or who will test positive and may never have it or may have it again? What I read in one article referred to as antibody-mediated immunity. So are there certain parameters that make some people just resistant to certain pathogens?
The answer is we do not know. That's about COVID-19. But from what we know and from what we can infer, all humans are not made equal. Okay? If you assault a herd of humans, I'm not talking about us as a herd, but that's a biological term. If you assault a population of humans, and that goes for many other creatures too, with any particular pathogen, not all of them will react to it the same way. A number will die, a number will fall ill, some will survive. From those who survive or who do not have it, will grow another population of survivors, and people will be who will be resistant or more resistant to that. That is how nature works. So immunity is not an all-blanket thing. This disease we are talking about, we have no herd immunity, no population immunity, because we had not been exposed to it before. Remember the Spanish flu that occurred in 1918? A ship landed in Lagos somewhere, and people disgorged, started spreading it from city to city. Nobody had any immunity to it, and that was why it decimated us. The same thing that's the way we are seeing it now. But over time, we will see people who will have immunity. Whether that immunity lasts lifelong, last a few months or last a few years before it goes down, we do not know. We are hoping that it's something that will leave a permanent memory or a long-lasting memory in a vast number of people so that they will be resistant to it should we, God forbid, have such an episode again. That is the way, that's the much one can say about that. We will have to wait and see. We have to wait and see.
Certainly, Professor. However, a number of serology-based tests for SARS-CoV-2 are currently going on mainly in China and the USA. Now, these tests are apparently for immune response to viruses, unlike RNAs. And it's also said that processing serology tests is also apparently simpler and also less tech-intensive than molecular tests. So are any current efforts currently going on in Nigeria for us to process serology tests or get involved in that, seeing as that will give us a better idea on immune testing? I'm reading a report from the Center of Health Security that says that these tests can give greater detail into the prevalence of a disease in a population by identifying individuals who have developed antibodies to the virus. So serology testing does seem like one of the ways.
Yes, serology is, we only show you who has come in contact with that disease before. It does not mean you are having it right now. So we cannot use it as a screening to say, okay, you have COVID-19 disease now, so today you need treatment. It's a marker in the body that says you have come across this condition before. So it has its uses. It has its usage in telling us what has been the trend in the community. Not that it necessarily has a good usage, and I use that word, good, efficacious usage, in saying this person has that condition now.
Pardon me to interrupt here, Professor, but that's what I'm saying. So therefore, for us to understand the trends of COVID-19 in Nigeria, should we not be looking at serology testing?
We will do that. We will do that. That will be done. But we need to focus first on mopping up, rapidly identifying how many have the disease, containing it, and being able to get the handle on not allowing it to spread like wildfire through the community. So I guess it's a matter of priority. If we can, while some scientists will be doing that, let others also be doing serology so we know what will be the exposure. And that will also be useful somewhere down the line. But if you ask me what is the number one priority now, it is to track down everybody who actively has that disease so that we mop it up quickly without allowing it to spread through over 200 million population.
Well, Prof, we have just about a minute to go, but I would like to have your thoughts on the way the Nigerian community has responded. I mean, individual responses by religious organizations. There are some individuals who believe that, look, COVID-19 is only for the rich. It doesn't affect the poor. Even when you confront them with the evidence, they will say, no, it's a problem for people in Ikoyi and Victoria Island. And then you have some religious leaders who have been making all kinds of claims about COVID-19, whether it's about 5G technology or it is something that they can sort out. In fact, at least one religious leader has said pastors should be allowed to come to isolation centers so that they can come and pray and heal COVID-19 patients. What's your take, quickly?
Pastors should not, no religious person should be allowed to go and start praying for COVID-19 patients. They should say their prayers in their homes. The same God that they are praying to will listen to them wherever they pray from. Because if they come into our isolation centers, they will catch the disease, they will spread it around the community. So nobody should take that away. Denial is not an option. And that is why I've had to also even appeal to people in Yoruba to please, I had to speak Yoruba language to appeal to people from where I come from, to please accept that COVID-19 is real. It's not a ghost disease. It's not a disease of the rich and poor. Everybody can catch it.
Well, thank you very much, Professor Bode.